What's the difference between hives, wheals and urticaria?
Well, essentially these are all words for the same thing that's happening. So hives is often used as another word for wheals. But some people also use hives to describe the disease, urticaria. In essence, if you have hives, if you have wheals, you have urticaria, and some patients also or only have angioedema. But the best is to use the word wheals when you talk about what's happening with the skin, the whealing, and to use urticaria as a word for the disease that is characterized by wheals, angioedema, or both.
How frequent is urticaria?
Well, urticaria is very frequent, very, very frequent. It's one of the most frequent skin disorders we know. If you think back, every one of us has had urticaria. As a child, you touched a stinging nettle, you had urticaria. Of course, when we talk about the disease, independent of contact to stinging nettles, then about 1 in 4 people during their lifetime have urticaria. And luckily, these urticarias are usually of short duration, some days, some weeks, and then they go away by themselves. Unfortunately, there are still quite a lot of patients who have this for longer than 6 weeks and therefore have chronic urticaria for weeks and months and years. And we think today that about 1% of the general population, 1 in 100 people right now have chronic urticaria.
Is urticaria a women's disease?
That's an interesting question, and the answer is yes and no. So yes, because women are at a higher risk of developing some forms of urticaria, especially chronic spontaneous urticaria, where the ratio is 2 to 1. On the other hand, everyone can develop urticaria, old, young, male, female. So it's not exclusively women, but predominantly women for some forms of urticaria that are affected by this disease.